So here's the position, here's the setup. It's real simple and it's really a lot of fun to do this. She's got that pulled up and it's real important that she keeps that bottom knee tucked up tight. I've got this up against my body like this. We teach it in class as a stretch for anterior hip capsule and also for rectus femoris. But we're not going to do that. We're thinking nerve now. We're thinking nerve. So when I come back like that and she starts to get a nervy pain into the quadricep muscles, okay, so I'll just take her to barrier into knee flexion and say, is that okay? Yeah, that's all right. Or no, that's a little bit, I'm feeling a little pain there. I back off a little to the interbarrier zone so that there's no pain. And then I ask her to tuck her chin. When she tucks her chin, it pulls it and she goes, yeah, I can feel that. And when she comes out, I will give it a little bit more. And then she tucks again, I will come off. She comes out, I tuck. She comes out. This is a flossing, and it's pretty good. A lot of people, that's not enough. They need a little more hip extension, so you pull the hip extension back a little bit. And now I bring them up to barrier. And she, first of all, Dina, I'm going to bring it up to barrier. And you tell me, for instance, that's the problem. You start screaming at me, and I go, okay, I stop, go back to the interbarrier zone, and then I'm going to have her tuck her chin there. And as she comes back, I'm going to give it a little stretch, back and forth. You'd be surprised how many muscle problems become things of the past, how much more flexibility you get when you start focusing on neural techniques. The brain starts to like the nerve glide, and it starts to relieve and release the spasm, the tightness, the hypercontraction that it's got in the muscles. What about hypermobile people? They're way back here already, you know. What do? Then you can change up a little bit. I get my body weight a little bit lower. I come in like this. I still got her ankle hooked to my hip. I've got this hand on her anterior knee. Now I'm going to come over on her hip like that and get low. This way I can get not only knee flexion with my body, see I'm knee flexing her, but I can also get hip extension. So I got both, hip extension, knee flexion. So I can play with both of those, hip extension, knee flexion, to get just to the right barrier for femoral nerve. Okay, tuck your chin. She tucks her chin, she goes, that's too much. I immediately relieve the knee flexion. And she comes back in again, and she comes out, and then I pull it from my way by pushing, say this is a hypermobile person, I'm going to give them both a little hip extension and a little knee flexion. She comes back, and she goes back, and then I give it to them.